We were asked to find the highest level of evidence on one of a possible 6 topics, and I chose the use of cannabis increases an individual's risk of developing a mental health disorder. I used a range of strategies, Pico question in 2 databases with results expanded by keywords, then limited using a top-down approach to level of evidence. Articles were considered if they were level 2 evidence or higher, a peer-reviewed study in humans, and published in the last 7 years, and the focus of the article needed to be cannabis as a risk factor for mental state disorder. Level 1 and Level 2 evidences are systematic reviews, meta-analyses, and randomized control trials. To recognize a systematic review, I looked for a focused question, clear objectives, and rigorous reproducible method. So, to our problem. Well, this is a statement and not a question. And this question needs to be Pico format. And there was a long process finessing the Pico question. In my trial searches at this time, what I thought of as my endpoints were cannabis use and mental illness, but these words produced different clusters of content. The meaning I was looking for was at the very least an association as a risk factor, or at the most causation, but abstinence skewed my results to drug and alcohol cessation. I read through a few papers and found the phrase cannabis non-use, and then I thought increase the risk might be better expressed as a risk factor, so I tidied that up, and now we have a Pico question, with a population, an intervention, a control, and an outcome. I brainstormed and harvested from articles as many keywords as I could, only to learn that too many words was as bad as too few. I finally settled on a short list of expanders, but I still wasn't happy. I felt many results were drifting into concept territory that wasn't relevant, like using cannabis to self-medicate psychosis. Reverse causation was interesting, but not what I needed. Using the words develop and risk focused my search results, but I wasn't sure if that was cheating. So I live chatted to the librarian, and the answer was yes, it's okay to add extra terms to limit results. I eventually felt the word risk alone gave me enough focus, so now I had my search terms. My next challenge was choosing 2 databases. By now I'd kicked the tires on quite a few. I had close to 0 results in Sonal and Joanna Briggs. PubMed seemed to overlap largely with Medline. I made a note of which databases had been searched in the articles that I liked, and I asked our librarians for ideas. Given the topic, PsycInfo was a natural fit, and Medline aligned well with the biomedical slant of the question. So, what did I find? I entered my Pico terms into the Medline search fields, and I gleaned 106 results, which on a skim read of titles and abstracts looked roughly aligned with what I wanted. So I applied my limiters, which narrowed my results to 10 papers, from which I selected 2 systematic reviews about the role of cannabis in the development of psychosis. And then I turned to PsycInfo, using the controls in EBSCO to pivot to a new database, where I applied my search terms again and found 994 possible papers. The PsycInfo results were noticeably more numerous and more technical than the Medline results, but I was happy with the focus of the titles and abstract that I skim-checked. So I applied my limiters and found 13 possible papers, from which I selected 2, a systematic review on the role of cannabis in depression and another on the role of cannabis in mania. Now that brought me to a short list of 4 articles. I needed the highest level of evidence, and all 4 were systematic reviews, so now I needed a way to choose the best. I started by printing them out and reading through them, marking up any thoughts as I went. But I soon realized that I was going to need a consistent set of criteria to rank the worth of these articles against one another, which looked like this. I reread the articles, this time making my notes into my homemade ranking form. And then I tabulated my data, assigning 1 of 4 grades to each article. I used strength of colour to portray ranking. The darker the colour, the higher the rank. The paler the colour, the lower the rank. When I was finished, the paper with the darkest overall band was the winner, which was this paper. from 2020, a paper titled Cannabis Use and Psychosis, a Review of Reviews, by an association of researchers in Germany and Australia. Overall, the search process can be summarised like this, leading to a single full-text article that I now present as the highest level of evidence. This was a systematic review of systematic reviews and meta-analyses. It was commissioned by the German Ministry of Health and published in 2020 as part of a collection, Cannabis, Potential and Risks, a Scientific Analysis. It was a very large study with a sample size of more than 295,000, gleaned from across 5 databases over 11 years. The authors are very experienced in their fields. The paper posed 5 focused questions. Do cannabis users and non-users show differences in the occurrence of psychotic illnesses? Is there evidence for a biological link between the use of cannabis and the development of a psychotic illness? What is the prevalence of cannabis use in patients with psychotic illnesses? Are there differences between cannabis users and non-users in the symptomatology and the outcome of psychotic illnesses? Do cannabis users have earlier onsets of psychotic illness than non-users? And made a series of positive findings. Cannabis increases the risk of psychotic experience. Psychotic illness arises more frequently in cannabis users. The risk is dose-dependent. The onset of psych illness is earlier in cannabis users, and early onset has poor outcomes. No association was found between suicidality and cannabis use, or with physical brain changes. The report made a series of recommendations. People with psychosis should be encouraged to stop using cannabis. Awareness campaigns should warn young people about the risk of psychosis with cannabis use. Those campaigns should stress 3 risk factors: use that starts in the mid-teen years, daily or near-daily cannabis use, and personal or family history of serious psych disorder. And in jurisdictions where cannabis is legal, health warning messages for cannabis should be put onto packs. So finally, back to our question. In adults, is cannabis use compared to cannabis non-use a risk factor for developing a mental health disorder? The current best evidence says yes, cannabis use increases the risk of psychosis. The risk is dose-dependent. The more you use, the more likely a psychosis. And then we come to the elephant in the room. Does cannabis use cause psychosis? Well, this review found no definite proof that cannabis use alone causes psychosis, though the team felt there was consistent support for cannabis use as a contributory cause. More work is needed to answer that question. So, what did I learn about the process of searching for best evidence? I got stuck at lots of points, but each question became a source of learning. A database is a complex tool, and database searching is a skill that takes practice to master. I often forgot what I'd already tried and what had worked. Searching is iterative. Navigating my search history was vital. Saving searches in the database or keeping good search strings or keywords in Notepad worked really well. Next time I'll formalize those learnings by keeping a version-controlled log of my searches in Excel. It was hard to choose the highest level of evidence when there were several high-quality results. I noticed I was biased toward results that aligned with my own opinion. A list of criteria helped to overcome my confirmation bias. Bias is something I'd like to read more about. I'd like to look at whether total citation helps or skews engaging an article's worth. Small changes in each search caused big changes in my results. It took lots of trials to learn how to steer the database. No 2 databases were alike. I had to experiment with keywords, limiters and expanders each time to build intuition from scratch. Next time, I'll make a series of project milestones. Database choice and search optimization will be key stages. Each article I read helped build vocabulary around the research topic. An exploratory phase is useful to frame the PICO question and to harvest search words. Next time, I'll include a phase for reconnaissance searches ahead of my final search.